Hello, this is the 8th episode for my 2020 podcast here at 0MD at youtube.com. The date is May 31 and it's the 77th day of the Luzon lockdown. My last video was way back March 3 and COVID happened. The world stopped for many people. But I was already in the thick of the battle before the lockdown. My boss and I share the same sentiments way back in January. COVID 19 will hit Olongapo and it will hit us hard. While the rest of the country were debating whether to shut down airports and recall OFWs, we were already at schools teaching everybody about the danger called COVID and what everybody can do to prevent it. It took the DOH 2 more weeks in February to issue a memorandum for us to do so. The City Health Office of Olongapo were already steps ahead by then, ahead of the national government. However, I fear that the worst has already happened. The Chinese New Year is one occasion in the Philippines when there is a large migration of people to and from China. There is also a mass migration of Filipinos to and from Binondo, Chinatown. With the airports not closed, I suspected that the first of the contagion would have come from there. I apparently was wrong. Hopefully, there was no other way to find out. There were no reports of severe acute respiratory illnesses coming from Binondo in the following weeks. Instead, the first cases have to come from somewhere else. 3 Chinese tourists fell ill and was admitted, but they were nowhere near Binondo. In the meantime, Olongapo City's preparation for COVID fell back. The national government imposed lenient measures and focused more on prevention instead of a possible impending disaster response. The city health has no choice but to follow the chain of command. Unfortunately for me, I had to face the first batch of COVID suspects. When we admitted our first 3 suspected patients, it became clear to me why the national government was not going all out with the response. We simply weren't prepared. There was a disaster plan laid out, but the execution was proving to be troublesome. Politics will always be in play, and this has caused the response time to investigate COVID suspects to increase significantly. Things became serious when one Filipino national finally became ill with COVID. Like I said in episode 3 of my Vlog 2020, that is going to be the time that I'm going to tell everybody to wear a mask. And that will also be the time that the DOH secretary will likely say and do so. Unfortunately, the DOH wanted to wait until criterias were met. Well, I was wrong on the part of the DOH, but I didn't want to waste a moment. I called my parents up in Manila to have them get ready for an impending quarantine. I told my wife to start wearing a mask. I had my kids pulled out of school. I even hinted at a local radio station interview that it should be time to wear a mask, but that the DOH and the local government was still saying no. I bought a month's worth of groceries at a whim, as if I knew something bad was going to happen. Of course, a lot of people didn't like it when they saw me wearing a mask, not shaking hands, and purposely saying no to social gatherings. How could they trust a naysayer like me? There was only a handful of cases, and the national government is still treating this COVID outbreak as an isolated case. Days before lockdown, the DOH itself noticed my overly obsessive attitude towards precaution. As I attended a DOH COVID response coordination seminar with a face mask, there were only 2 of us who did so. At one point, one provincial coordinator had to ask if I was sick because everybody else at that seminar was convinced we needed to teach everybody not to panic and not to wear masks yet. A day after that seminar, a co participant was admitted and intubated. He was the first doctor to have died in Region 3 from COVID 19. Everybody else in that seminar, including me, became under observation. I was right. The COVID infection outpaced the DOH's response. That mistake had claimed the life of one of the best doctors in the region, and I almost got COVID myself. When the national government finally admitted its mistake, it finally rectified it by imposing a large scale lockdown. It was too late to issue any kind of targeted quarantine. COVID was just moving so fast. I had to drop everything and focus on the response. I was placed on one of the task forces in Olongapo that handled contact tracing during the lockdown. Now, as the GCQ ends, we are finally at the transition to the new normal. The threat of COVID 19 still looms over us, but we have done our best to curb the might of the disease. But the state cannot hold quarantine much longer. The resources are simply not enough. As the Philippines reawakens most of its economic activity, Filipinos have to understand the simple rules of basic healthcare system. If COVID gets unchecked again, we could get shut down once more. Well, that's all I have to say for today. Hopefully, you are subscribed to my channel. If not, you can click on the button below and the bell for notifications. You need that since I don't post with a schedule. And if you like this video and you want to see more, check out the links on your screen. Again, thank you very much for watching. Peace out. I am Zero Melia MD.